Good evening, Dr. Parikh.
Good evening. Always a pleasure meeting you,
Always my
speaking to you.
pleasure. Always my pleasure. And always eternally grateful that you take the time out every time I ask you to take some time out.
Can't say no to friends.
No, absolutely. You have no choice. But it's a
Yes,
busy day for you today, isn't it? There's a lot of,
it, it has been. It has been. But
so, you know,
my
I,
reflection is that I wish
mhm.
all days could get the kind
Yes,
of importance to mental health. But I'll take what
yes.
I get one day at a time and a chisel in our hand.
No, excellent. And that makes me actually ask you a question. I would have pretty much asked you right in the end. Uh, what's your biggest reality check this day today, this year, this day?
Reality check is that it's still a long way to go. I mean, I'm what, 20 plus years now into practice. If you add my education years, then it's almost 23, 24 years. Have been talking about various aspects of how mental health needs to have the last mile reach.
Yes.
And the reality is that we are far away from it. So, not sure how much I see in my lifetime. But yes, digital medicine or digital India has been an absolute fantastic um, add on to provide for services in mental health, because I think it's creating an outreach and it's bringing costs down very drastically. And I think that's remarkable in itself. I just wish that we keep working on it and just make mental health a priority. There isn't any other way around it. If COVID hasn't taught us the importance of mental health, what would?
Yes. So COVID would have been, if you look at COVID, there are two aspects to it. Like you're talking about digital medicine, everything just kind of went online. The sessions went online, and yet the cases went boomeranged out of control. I mean, it was not easy. I know I spoke with you trying to get an appointment for a very close friend of mine. How do we understand this hybrid way of going forward?
Oh, we need to understand this that, see, it's a fact that we have the population that we have. It's a fact that we have the urban rural span that we have expats. It's a fact that we have about 500% or so shortage of experts in our country. Now, we can't change this. It's going to be a process. What can we do? So, what I've been talking about this year is choose actions that matter. So, let's split this. You are an author, a media personality. You talk about mental health, that's your contribution. You write about mental health, that's your contribution. Whether one person reads or a million reads, you've contributed. Now you change this. Let's say you are a corporate leader. In your microsystem of your corporate, how about valuing mental health outcomes, giving psychological first aid, ensuring that the vulnerable people are helped? Now go to schools, bring mental health curriculum and life skills, do psychological first aid training, empower children, do the same in college. Go to RWS, bring a sense of connectedness, use digital transformation, Digital India, to ensure that people stay more connected. There is social media. I mean, this is a positive conversation we are having on social media. We can find time for the selfies. We can time find for the filters. We can time find to be as useless as trolling. At the same time, you can do this. How about using for connectedness and positivity? Funding needs to happen in mental health. Lots of CSR needs to happen in mental health. A national suicide prevention policy, government implementation. You bring all of this together, add helplines and vernaculars, integrate with primary care mental health systems. You put all of this together, do that for the next decade. Now, that's how you achieve results. That's how you make a difference. It can't be bits and pieces here and there. It just needs to be a consistent effort.
Yeah, mental health is some 0.01% of the health budget anyway, right? I mean, uh, but speaking about what it's like for people on the ground, COVID hasn't helped. The isolation, the physical, the social, the mental isolation, it hasn't helped. Now, for anybody who's looking to get help, and bear with me because there are a lot of people who've on a day-to-day basis. I mean, I've spoken with you about it personally, that you don't feel inspired and you feel on edge. And so how does one differentiate between that, the rut that we've got into thanks to COVID versus some genuine panic attack, or the feeling that this is going to go beyond, and which, yeah, like, how do you decide when you must go for therapy?
If you are having any distress, which is having a negative impact on the quality of your life, you seek help with a professional. If you are struggling and you can talk to your family and friends, seek their help and support. If you tide over that, then it probably was a here and now stress oriented thing. If it is becoming more regular and causing impairment, go talk to your family physician. You don't always have to go to a psychiatrist first. Your family physician is in the best position to tell you short course of meds, maybe a bit of counseling, or yes, go see a psychologist, go see a psychiatrist. Let that happen. We need to re-strengthen the basics of our healthcare system, which I am continuously saying, it's primary healthcare. We need to strengthen primary healthcare. Big, fancy, state-of-the-art tertiary care is also required. But it's all not going to be useful. You can do the world's most difficult surgery, but you need to take care of what is most common. And that happens at a primary care level. And at primary care level, you do best possible training and you make it as conducive as you can. That's how you bring a change in mental health. It's not going to be reaching a psychiatrist every time. That's just not going to be a solution.
But also the solution, the other thing, of course, is the mindset, right? The mindset that it is okay, that it is not okay to get medicated, that log kya kahenge if we go and get some medication. And I honestly want to tell anybody, I'm not an expert, but I can tell you I'm surrounded by a lot of people who've taken the medicine and they feel absolutely fine about it. And I would urge people, actually, and I would actually ask you to say how should they go about it, because there's always that trepidation, no, doctor, that दवाई नहीं लेनी.
See, look at it from 2-3 angles. One, when you wrote your book, how many people would have told you don't write on this subject?
Oh, they're still telling me.
Right? And I've been telling you, when is your next book coming on mental health?
Absolutely. Absolutely. And
so it's a way we look at it. Yeah. It's a way we look at it. The other aspect is, see, before 50s, there were no medication. The decade of 50s, there was an odd medication here and there which did not have the best side effect profile. By 70s, meds started coming in. By 90s, significantly very good medications also came in. So these are all myths. So let's say if you have depression, you will take medicines lifelong. Not true. They'll be stopped for most people. If you are taking medication, they'll be all sedatives. Not true. Only sedatives are sedatives. Not all medications are sedatives. If you take medication, it's a weakness. No. If I have diabetes, I'll take a medicine to reduce to get my insulin on track. If I have depression, I will take medication to get my serotonin on track. It's as simple as that. They are not going to impair your functioning. You will not become dependent. And these are the myths. But how do people let go of the myths? That happens when conversations are consistent, where role models speak about it, where the so-called influencer community also speaks about it. Because when an individual goes through, so let's say so I have thyroid. If I can say here that I have thyroid and you take a thyroxine every morning, it could have well been I could have said, listen, I have ADHD. A lot of people would want to actually say that that's true. And I actually believe that if I would have been born now with the kind of attention span that I have and the hyperactivity that I have, how would I have been handled by modern education system? Because back then, the sheer compassion and the space given was remarkably different. And I still believe if medical education exam wouldn't have been a multiple choice questionnaire, I would have struggled with the kind of handwriting that I had. So it's the way you integrate people. One needs to understand this. And that's where social media also comes. Don't share faulty information. Don't spread negativity. You don't like something, leave it. You don't like someone, don't follow that person, but you don't need to abuse. We need to understand these aspects of life. We are on the planet for a short span in time. Contribute.
Yeah, because it's social media is really ingrained in our lives. So, I think a lot of people underestimate the impact that it has on our mental health, actually.
Yes, yes. And that's why I feel media literacy, mental health curriculums, talking to young people about digital interface, helping them create the balance. These are important because whether it is online bullying, online gaming, whether it is online pornography, whether it is various other aspects of direct impact on lifestyle, mindset, social relationships of youth, we need to appreciate that we need to also empower them with the skills of how to deal with it. Don't be on social media is not going to be a solution for the next generation.
Yeah.
Don't have a smartphone is not going to be a solution. That's like speaking from Jupiter. It's going to be there. So now how best you can use it has to be the only question.
Right. So I'm going to continue taking some of the questions. If anybody else has any questions, just put them in. There is one from Shivani. She's asking you, is there a suicide prevention helpline with your organization?
Yes, lots of organizations, including ours. Our helpline I will share with you. It's 837-680-4102. And you can get these details on our social media pages as well. In about 14 languages, we provide for crisis intervention round the clock. But there are lots of helplines. If you'll go on any social media platform, we are on Instagram right now, it could have been Twitter or Facebook, most of them have a listing of helplines. I do feel that the number of helplines that we have in the country needs to be significantly increased with a lot more vernacular presence. That's having said that, but there are helplines and more helplines are coming up, and I think that's a good sign.
But there's always that other side that the helplines don't work. You never get through. They're always coming engaged. What do we do? I mean,
no, but to be honest, we also go through that. I mean, I'll be very honest. I mean, at the end of the day, we are clinicians. So what we've done is amongst us, we take time out and keep the helpline with us for every few hours, right? We are doing it more out of our own responsibility that we know we need to do this. So yes, if I am on a call and the call wait will come, I'll try and return that call once that call is over. And that's a fact. There is no denial to that because we aren't a helpline provider. We are a clinical program which also wants to provide for community support. And that's why I'm saying one of the reasons why you would feel helplines are unable to answer is because the numbers of calls are very high. So that's why we need more and more people to be into it. If I look around the horizon of healthcare providers, how many healthcare organizations which have tertiary healthcare in our country have a mental health helpline? So until more helplines are there, few helplines would be able to help those people whom they'll be able to cater, because at the end of the day, it's almost like a manual component to it, that you have person A who's available on a helpline can only talk to person B for that 15-20 minutes, half an hour, 1 hour. And healthcare providers need to really think about it, that how do they integrate mental health with healthcare?
Yeah. So, I mean, this same Shivani, she's asking, can she volunteer? Is that something that is a possibility, Doc?
We are not doing that right now. And we'll be honest, Shivani, what we are doing is that we are clinicians, and those clinicians who are working with us take about 20% or so time out for community well-being. And that also ensures that how we go about the helpline, we are able to maintain a certain level of efficiency. What happens in the model where there are more volunteers, so one has to look at their education background, their training. So like we said, that we are doing it because we see that as a responsibility, but we are not, we don't have the IT or the advances that we'll be able to have a lot of people doing it. Although I see that happening in the future. I do see that because even today we struggle with the number of calls that we get. And that's a conversation I need to have back home with my own people at Fortis, that what more we can do. But I do feel that more healthcare providers need to be doing this as well. We can't be having only a few people doing this. That's not a solution. Also, and helplines are also not an absolute solution. Helpline
Yes.
provide for crisis intervention at that time, but we
Yes.
also need a long-term solution, which needs to be looked into.
Yeah, and when we're talking about that, how does somebody, figure out that another person is getting triggered, that that other person around them, or some friend, acquaintance, a family member, relative, anybody is getting triggered to the point that it could get dangerous? How does that person, how does that person decide when to seek help for someone else?
So you see any change in behavior, especially somebody getting withdrawn or irritable, not meeting friends or social engagements, uh, talking about life not good enough, talking about death, talking about dying, talking about a sense of hopelessness, going into a low shell. These are some of the red flags we need to look at.
So there's another one I'm interested in, psychology. Fortis, mental health makes me do more towards it. So it's it's a good thing. You're setting very good examples. I mean, it's something that is really needed, as is the media literacy is the need of the hour, as you were just saying as well. I think a lot depends on how, as we said, social media harnesses it and how media itself harnesses it, right? Do you think it's adequate for the kind of attention it gives at this point?
No, I don't think we've integrated it well. And I do feel media can do more. It has done a lot, but it needs to do more and consistently. I mean, something like, for example, guidelines on reportage of suicide. I think that needs to be very, very strictly followed. But I also feel that social media platforms need to be very, very strict with their guidelines around the conversations around suicide specifically, and need to red flag posts which, in any which way, are increasing the stigma, or in any which way can be have a negative influence on people's mental health. And I think that's something that needs to be looked into.
Why is it that suicide is so huge amongst teenagers in the country today, Doc?
So it's multiple reasons. If you look worldwide, then for this age group of adolescent and young adults, it's the fourth highest killer.
Yes.
And so that's happening worldwide. So it's not only with us. Lots of factors. I think one, a lot of mental health issues go unidentified. There is a lot of peer pressure. There is there aren't enough skills that we are empowering young people to. We've not been able to encourage help seeking behavior significantly. We also need to look at providing for timely intervention and the accessibility to that intervention. We need to integrate the family and the societal system that is compassionate and is able to provide psychological first aid and an environment where these young people can actually flourish and find it safe. It's a lack of all of this, which is what the reason is.
Another question, what do you do when you do not feel motivated and you feel low and lonely?
If you're feeling lonely, pick up your phone, talk to a friend. With COVID appropriate behavior, go meet someone whom you can, who's accessible to you. You make sure that you have a rhythm to life, that you have a routine and a rhythm to life. It's very therapeutic because you will have something to do. Sometimes those thoughts that come when we have nothing to do, that also would help you. And if you are feeling low, talk to someone, unmute yourself, talk to someone, friend, family, colleague, senior. All
Yeah,
of us have experienced low moods.
yeah, and
It's
stay
not
active,
possible.
I guess.
Yes. And yes, stay active, be mindful, indulge in activities that give you both relaxation and pleasure. Do that. But social support, connectedness is the key to our well being. And I hope COVID has taught all of us that very, very
Yeah,
clearly.
yes, I think so too. Is CBT best for suicide prevention?
There are lots of forms of therapy which work. So whether it is psychodynamics, CBT, dialectical behavior, family systems. Also, there is role of in prevention. You're looking at life skills. You are looking at crisis intervention, looking at mental health curriculum. Lots of aspects need to be seen. To say that only CBT would be most effective, no. But it is very effective. So both aspects.
I think the whole cognitive field, like psychology, psychiatry, and neuroscience, need to integrate, and also these fields need to integrate with non-cognitive fields. What is your
Yes, I mean, it's a multidisciplinary science. It needs to be integrated. I mean, all forms of allied specialities of mental health need to work together, and healthcare needs to integrate mental health with its own system. I think that's something which is also very important. To have a preventive health checkup that does not have a psychological input is ridiculous. To have tertiary care where you go through significant surgical interventions and don't get the psychological support is incomplete treatment at best.
So here it's a question I was going to ask as well, but we need to work together to spread awareness related to mental health. What is it that we can really expect results out of when we look at creating awareness?
You don't expect results. You expect change, and change takes time. Nothing happens overnight. That's the only way to look at it. When I was a student, I did not know 10 September was World Suicide Prevention Day. Today, all of us know that. You go on any social media platform, they will tell you it's Suicide Prevention Day. Somebody or the other has done something or the other to do the awareness.
No, so I agree with you, but you know, the thing is that the children are more aware, they're more exposed today, and the kind of accessibility is a little bit different. That the boundaries get a little bit blurred, because when a child just says, when a teen just says that I am just, you know, it's just about self-harming, but that self-harming can quickly go across to the other side, because you know, it's all about that moment for these children, which I have figured out. How do we create the awareness with them and for them?
It's an ongoing process. It's not going to be overnight. And that's why when I talked about mental health curriculum is one of the solutions which can actually show dividends in years to come. So imagine that you have school teachers all trained in mental health curriculum. Imagine a school where students go through that curriculum throughout their 12, 13 years in school. So they will come out with much lesser stigma, better life skills, more coping and resilience skills, will be okay accessing help, and will understand the importance of wellness.
I agree with you, and I think schools are still struggling, and I think they will be. And my big worry, actually, Doc, is that you know, now that schools are reopening, they are going to be actually focusing just on the studies that have been missed, and I think everything else, which actually needs more importance, is going to get buried. What is your sense?
I mean, to me, when schools reopen and they have started, I think our first job needs to be to try and take care of the anxieties and the distress of children, because they've also for a year and a half been living in a very different way, and now it's coming to a different style of functioning. Give a couple of months for integration, adaptation, adjustment. Go slow, focus on social stimulation, creative stimulation, well-being, and yes, then trickle in the academics slowly. I mean, let's not forget, we collectively took a decision of not having 12th board exams.
Yeah.
Right? Absolutely. It's a landmark thing that has happened. Generations to come can be given this example, that when it comes down to safety, we don't take 12th board exams. So next time when somebody feels that it's a life-altering event of 12th board exams, and if I don't do well, life will be completely different. Remind them that even without the exam, your life will be fine.
Your life is fine. Absolutely, absolutely. Okay, another question. How can you provide timely intervention?
Awareness. There is no substitute to awareness. Awareness of the self, awareness of the people around me. If both of us have adequate awareness, we'll be in a better position to reach out for help. So if I notice that you have something, then I help you, or I am noticing for my own self that I'm struggling and I reach out for help. That's how timely intervention happens. And then you'll have the ladder of help, which is immediate family and friends, colleagues and seniors, your family physician, so on and so forth.
Manvi's written social support is important. I want to broaden that into an entire support system that is very important.
Yes, I mean, who are we
But
without
where,
a support system?
yeah, but for issues
What
like
can we do
this,
by ourselves? What can we achieve by ourselves? I have always said this, there is no I in success, there is always a we in success.
but how do we
Show me
build,
a successful person who did it without a support system.
but how do we build a support system on issues like this? Because there's just still such a huge, I mean, I find that during COVID, at least the stigma has lessened a little bit, but still there is just so much of issue with acceptance. There's so much denial, especially with the young ones. And as I just said, suicide and the young ones is a big issue. So building that support system when there is no acceptance, there's no problem.
So this is not going to happen suddenly. This is going to be a process. We all accept that the acceptance is better today than it was yesterday. With the same logic, it will be even better tomorrow. Now, what we need to do is accelerate it. But we'll always have the naysayers also, who will have their own reasons. But if the people who are aware and accept a science, the importance, prioritize mental health, once they start outnumbering and become vocal about it, you will see the difference.
Yeah, and I think baby steps, we all do what we have to do. We all should just, uh, do whatever we can in our little ways. And it turns out to be a big way at the end of the day. But this is another question, which of course is a huge one. How would you deal with hopelessness that comes around after losing a loved one? And, so many families have gone through such a terrible time in the second wave and struggled with grief and loss, Doc.
We had this conversation the last time
We
also,
did.
and I'll say the
We
same
did.
thing I said last time. Grief is an individual personal experience. I'm nobody to tell somebody else how best they should deal with grief.
Yeah.
Resolving grief will take time. What I can do is be there for you and be there for each other. If you have the right kind of support and people around you, you'll be able to deal with grief better. But we'll all take our own time to heal when it comes to grief. There is no toolkit for bereavement. There can't be.
No, there
This is
isn't.
too deep and too personal for every person.
This, I think we've already dealt with in a way when to refer to psychiatry for a client to prevent suicide.
You can go to any expert, physician, helpline, psychologist, psychiatrist during a crisis. If a psychiatrist is required, any of the non-psychiatrists I mentioned will direct you there. Or you could go directly. Either way is fine. You're reaching an expert. You're reaching help. That's more important. Once you are at help, the help will guide you to whoever should be working with you at that moment in time.
So here's a tricky one. How do you deal with a family member who's demoralizing and disturbing your mental peace?
Things are in our control. There are things that are not in our control. People's thought process cannot always be in our control. So you may have A, B, C, D, 4 people in your family. A may have a certain personality. You ensure that the negative experiences of A are diluted at best as it's possible by your relationship with B, C, and D. It is each dyad that builds our self. No one dyad is more important than the other. If you keep working with your dyads, you'll be a more surer self. And that's the way to look at it. And once you realize that somebody's reactions to you are more because of that individual's personality, then don't do self-blame. And I think that's very important.
Yes, very, very important. And at the end of the day, otherwise, get in touch with Dr. Parikh if nothing else works. It's true. You have no choice. But I have to stop asking these questions. Which test is used to measure suicide prevention? How do we increase the reach and awareness when these live sessions are only being attended by people who already are in this field? No, not really. That's not true. I think a lot of
Yeah,
people do come in.
let's not generalize. There is no
Yeah,
generalization in life.
yeah.
It
No,
doesn't
there
work like
isn't.
that.
It doesn't work like that. And like I said, it's all baby steps. We all do what little we can, and it always helps. I said the same to you, Doc Parikh. I said if 5 people read my book, I'll be happy because somebody would have got things out of it. And I say the same for this. If 15 people are watching and 15 people get a little bit of an answer to anything, I'm grateful, and I'm always grateful to
And
Dr. Parikh.
that's the contribution, because that's the contribution. We all in our capacity can do something. That's how you build blocks.
Yeah, yes, absolutely. So, we are going to have, I promised you the half hour, so I have to let you go. But it's always a pleasure to speak with you. I'm hoping that, more and more people understand that it's okay to speak up when they feel uneasy. It's okay to seek help. My only worry remains, Dr. Parikh, is the younger ones. A lot of them have been writing in to me also, and I think I've been telling you this, that, the most poignant one was this girl who wrote to me recently, very, very young, I mean, 13, 14, 15, from what I remember. And she said, I don't feel well and I don't feel okay. And can you help me? I said, look, I'm not a therapist. I cannot give you the right advice. All I can do is try and put you in touch with somebody. And she said, I'm really sorry, I have nothing to pay you because my family doesn't believe that I have a problem, so I have to do this on my own. I have no money. I promise to pay you when I grow up. And I said, absolutely not. I mean, there is someone who's now giving her pro bono sessions, but this is the section of our population that worries me, and their isolation has been intense for the last year and a half.
Two aspects, Jyotsna, when it comes to providing for healthcare, this kind of a dilemma is always going to be there. Today we are talking about a mental health concern. It could have been a cardiac concern as well. It could have been an endocrine concern. And that's where you have public healthcare and private system. Robust, integrated mental health in primary public healthcare, public-private partnership, digital India, skill building, consistency. All of this, when you put together, that's how you are able to cater and help and support different strata of the society. That's how we need to build the mental health of the nation in years to come.
Okay, last two questions. I'm not going to take any more. I have to let Doc go. How to deal with the feeling of not belonging to this planet. This is
Oh,
time.
you do. You feel. So you belong. The moment you feel, whether the feeling is positive or negative, you very much belong. Today the feeling is negative. I can absolutely guarantee you the feeling in a few days' time or few hours' time at times, depending upon who you are with, what you are doing, what you are thinking, will be completely different. And you keep contributing. Purpose and meaning are the best ways to feel good about yourself.
And if a client believes in pseudoscience about suicide by referring to astrologers.
I have no issues in that. I'm absolutely fine in people having their belief systems. I don't need to fight belief systems. I don't need to fight people's faith. In fact, as a therapist, you utilize faith. You use it in a productive manner. What I would do if my client would say that I want to do something that I may or may not believe in, all I'll say is go ahead. Just make sure you still take the medications prescribed to you. You still do the lifestyle advice given to you. You still take the therapy that was given to you. That's fine.
And don't stop
It's
your
not a
medication
job as
without asking
therapists.
the doctor.
It's not a job as therapists or doctors to try and change people's belief systems and faith. Our job is to improve the quality of their life, provide for ethical, evidence-based treatment, and support people. That's the way one has to go about it.
And also, like I was saying, when you think, I think a lot of people just think when they're medicating doc that they're okay after a little while, and they just discontinue those medications without going back to the doctor. And I think maybe you just want to tell them that that's not really the procedure.
For any branch, it is not the procedure. If it's an antibiotic or 5-day course, you don't stop it in 3 days. If it's a medicine that's given to you, like for certain illnesses, for let's say a year or 2 years, you take it. If it's some other painkiller where the doctor tells you don't take it after 2 days, you stop taking it after 2 days because that may have its own habit forming potential. Applies the same. You be compliant, you follow your doctor's advice to the dotting of the I.
And what if a client does not take the medication? Refuses to
You
take the
keep
medication.
working, you keep working. How can life ever be 100 on 100? But you do your best. You provide for the best advice. You give the best evidence. You continue doing that.
Yeah.
And yes, people will be impacted by various other vectors in the society. It's a friend who's saying something, it's a colleague who said something, it's something somebody read. These things will also be happening. And that's why awareness is so important, that some of these vectors acting on people can be stopped.
Yeah. No, Chaiti, I completely agree. Many people shy of medication. I don't understand why either. I'm still trying to push a couple of them to go to a doctor. It's a hard road. But Dr. Parikh, your final words on this day today. I know
Three
you're going to
things.
say, go for it.
3 things. Unmute yourself. 2 parts to it. Part 1 of unmuting. Seek help whenever you are needing it. Part 2 of it being unmute your compassion and support when somebody reaches out to you. Second, together we can. Until we are together, we will never have solutions in our lives. And third, choose actions that matter. Whatever you do needs to have a meaning and a purpose for the well-being of yourself and people around you.
And that's why I keep coming back to listening to you. Just the best advice, if anybody gives it, is Dr. Parikh, Director, Department of Mental Health and Behavioral Sciences at Fortis Healthcare. Um, yes, always down to earth and always just advice that, we can easily listen to. I mean, I don't understand why people have to say that they're not going to listen to therapists when we have therapists like you. But it's my pleasure always to speak with you. This is definitely not the last time, you know that, and I know that. So I will be chasing you again, but I'll give you a breather now because I know it's a long day and you've got to run and you've been on this nonstop. But thank you so much, Doc, for taking the time out for me today. And well, we wish everybody, good health and good mental health, and hope that, take help, talk to people. Yes.
Thank you.